To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
Coronaviruses mutate all the time. Most of the mutations don't have any physiological relevance with regard to the function of the virus itself.
When do we get back to a couple of hundred new COVID cases going in?
Last night, the Department of Health announced that there are 2 presumptive positive cases of coronavirus disease in the state of Florida.
I want to be clear, this is a supply problem. It's not a distribution problem.
Today we're setting up a county call center to screen calls.
Hey Dad, I know you can hear us. See your eyes opening. It's just so special to see you.
A very dangerous situation. It was a virus that many people didn't know about. It was deadly, and we were going to have to take some extraordinary measures, something that we have never had taken probably as a country in about 100 years. One of the first things we did is close the senior centers, but then we also knew that a lot of seniors, that's the meal that they get. So now we're closing the senior centers, now we have to feed them. So we were feeding 3 meals a day every day, millions of meals. The whole idea behind it, the theory behind it, was to try to, it's impossible almost to control the virus, but at least control the number of people that are getting infected at any one time so that you wouldn't overwhelm the system.
The city of Miami is implementing a curfew beginning Friday, March 27th until further notice.
We have to be prepared for the worst. I want to stress, it's a precaution.
It was about a 450 bed hospital, so that we had any overages on COVID patients.
We're making sure that there are enough testing locations that is going throughout the state of Florida. More particularly, we know within the African American community, we know that Opa-locka is the epicenter.
This was about understanding that speed was important. And this was the time when we had to cut all the red tape. There had to be a unified form of government, a unified form of response with all of the agencies working underneath the Division of Emergency Management. And then it was about just making sure that we can get the resources that people need in a timely manner. And so I was away from my family, but even the people who work in the Division of Emergency Management who live in Tallahassee, they were away from their families too. These folks dedicate their life to responding when everyone else needs help.
Also, yes, we were in the height of the COVID pandemic, and there was a lot of controversy at that time about what protections were important to take, and I was very adamant that we would spare no resources to protect our community.
That's a huge response for us. That's an extremely positive response. We're taking a lot of positivity out of that.
And that was extremely important to my administration. We were able to have ready access to an expert immediately to pivot and make important decisions as needed. How to make sure that people did not come into the hospitals because our healthcare workers were totally maxed out, exhausted, vulnerable themselves, and truly one of the critical measurements was what was our hospital capacity. It was so important that we give them all the protections we possibly could. The personal protective equipment, the PPE, masks, the sanitation, the distancing, the plexiglass, all the things during those early days that helped to reduce the risk. And we did that through amazingly creative outreach efforts. We had a Vax Now team that went door to door in underserved neighborhoods with volunteers knocking on doors. We had pop-up vaccination sites through churches and other community organizations. We worked with our business community for an I Did It campaign, We Did It campaign. My own father died of COVID while living in an assisted living facility, despite being double vaccinated.
And they depend on their family to help them with eating, with bathing, with dressing. It created a huge burden on the system. It created stress for those in the facilities, for the residents who were cut off from their family members for months. What I was very concerned about in nursing homes and assisted living facilities where you have many individuals in semi-private rooms, the buildings on average are 35, 40-year-old buildings. The COVID virus could spread rapidly. And the staff were there. And it's remarkable. Again, sometimes I think after we get used to something, after we get used to seeing it, we don't really appreciate how much was involved, the rescheduling that had to occur, because people were taken off of and away from other responsibilities.
So we were the first state in the nation to do this. We also ran the largest program in the country. And that was, we instituted mandatory testing in all of the nursing homes. It was bi-weekly testing. We tested staff in all of the nursing homes across the whole state.
And so we were really facing a shortage, and the competition for the healthcare worker was leading more and more of them to either go to other places on a visiting basis where they could earn more, or many dropped out. It was they did not want to be exposed themselves. They were at risk.
It's been a challenge, but it's also been fun because our enrollment is up double figures, and I think it will continue to go up because people during the pandemic were so impressed with nurses and others that they said, you know, that's what I want to be. When I'm in the community and visiting different fire departments, our students are always there. We are spread out all over the county and all over Florida, and our paramedics were just instrumental, I think, in those times when we were all trying to make it just from one day to the next. So when our students came back, they were so excited, just as excited as our faculty were. And one of my favorite stories was Jackson Hospital called us in the peak of the pandemic, and we're short ventilators. So we had 17 working ventilators that we loaned to Jackson Hospital.
No? Okay.
What it has allowed us to do is to teach all of our students and programs together. We can bring medical assistant students with respiratory students, with nursing students, and it's really revolutionized how we can prepare our students for future jobs. I think we all have a special place in our heart for people that help us, and certainly the healthcare professionals did that so well during those times, and even now we still hold them in such high esteem, and we've always held police and all those people in those roles, but our healthcare workers were truly heroes and really helped us survive the last 2.5 years.
Thank you to all our elected officials, our government officials, our first responders, our volunteers, our staff, our sponsors, Miami-Dade College, for helping put together a deep and personal view of what happened through this crisis. Thank you to all of you for being a part of this. And again, thank you to our healthcare heroes.